Hi, this is a presentation on Japan's healthcare system by Sarah Valdez, currently attending Loma Linda University. This presentation is being displayed for course HLIN 321, Health Information Science and the Healthcare System, instructed by Professor Terry Rose. The Japanese medical system is provided through universal health care. The country's first form of public health care began in 1927 with an employee health insurance plan. In 1961, at the beginning of a period of rapid economic development, while the country was still relatively poor, Japan reached full health insurance coverage of its population. In this presentation, I will be discussing the different types of coverage held by Japan, for example, universal public health care, social health care, SHI, and national health insurance, NHI. First, I will be discussing about universal public health care. In 1961, public health care evolved into universal coverage. It's been almost 60 years that Japan has maintained universal coverage, a legal requirement for all Japanese citizens to have health insurance. It is also available for non-Japanese citizens remaining in Japan for more than a year to obtain health coverage. It is provided by the state, and medical treatment is provided. The goal was set to provide reasonable access to necessary and adequate medical services to the entire population at a relatively low cost. Now I will be talking about social health insurance, SHI. Social health insurance applies to everyone who is employed full-time with a medium or large company. Japanese firms do contribute to their employees' health care cost by paying part of their employees' premium, as well as through corporate tax revenues to finance health programs to the elderly. SHI also maintains Japan citizens with benefits for surgery, hospitalization, and birth allowances. Approximately 5% of salaries are dedicated to pay for SHI, a cost matched by employers. Japan's other system is national health insurance. National health insurance is a community-based insurance, and anyone who is not qualified under the social health insurance is covered through this insurance, like students, freelance workers, and the self-employed. Each person in a household must enroll in NHI as an individual member. More than 90% of all Japanese hospitals and clinics, including dental clinics, accept NHI. NHI also provides benefits for high medical costs associated with surgery and hospitalization. It's based on individuals' income and assets. The patient cost sharing is higher, and the state pays 50% of costs under the municipal plans. In the healthcare system, we cannot forget to talk about the elderly. So in this slide, health insurance for the elderly falls in two categories, such as ages 75 and older and ages 65 to 75. In 2000, Japan initiated long-term care insurance, allowing everyone 65 and older to be eligible for benefits based strictly on physical and mental disabilities. First health insurance for the elderly was created in August 1982 and fully enforced as of February 1st, 1983. Benefits are financed by 50% by taxpayers' money, 40% by contributors from the working population, and 10% by the insured people's own premiums. Currently, the elderly account for 28.1% of the population, and it is predicted to increase in Japan to 29.4% in 2025 and 36.3% in 2050. The elderly population is a main reason that medical expenditures are increased in Japan. Next, I will be speaking about Japan's payment mechanisms. Payments for doctors and hospitals are all the same. Fee-for-service basis, package payment for elderly, medical treatment is listed in the fee schedule, and we have Japan's hybrid system. Government pays 70%, private health insurance pays the remaining 30%. Like I mentioned before, payment to the facility is in principle on a fee-for-service basis. The price for each insurance covered medical treatment is listed in the fee schedule, revised every 2 years, which is determined by the government based on a recommendation by the Central Social Insurance Medical Council. Yet, a different version of the fee schedule has been prepared for the elderly to get rid of unnecessarily long hospital stays and promote treatments that are appropriate for physical and mental characteristics. Now, the fee schedule includes co-payment rates for patients and reimbursement to healthcare providers for most healthcare procedures and products. These co-payment rates vary between 10% and 30% depending on age. For example, we have 30% for patients ages 3 to 69 years old. Then we have 20% for children 0 to 2 years old. And then we have 10% for elderly 70 years and older. Okay, let's take a look at cost of healthcare in Japan. The cost of healthcare varies depending on age, income, work, and location. For example, on the slide I have ER visits and doctor visits. The ER visits range from 10,000 to 15,000 yen, which is $92.12 to $138.18 in US dollars. Now for doctor visits. Doctor visits range from 5,000 to 10,000 yen. That is $46.06 to $92.12 in US dollars. The cost of public health insurance for one person is 5% of their salary. As I was researching, I found an article from 2016 mentioning that Japan spent 42 trillion yen on healthcare, which accounted for 10.9% of the gross domestic product. 42 trillion yen is equivalent to 387 billion US dollars. Now, I currently have a sister-in-law who is living in Japan. Her name is Diane Yan. In Japan, she is teaching English, so she currently has universal health insurance. I asked her about the cost of the healthcare in Japan, and this is what she responded to me. Quote, an appendectomy costs the equivalent of 3,000 yen. 3,000 yen converted to US dollars is $28. In the US, an appendectomy is approximately $55,000. This is way overly expensive compared to the cost in Japan. There will be more quotes on what Diane Yet's observation of the healthcare system in Japan. Let's look at the similarities between the US and Japan. The US and Japan both have rising costs. They also have increasing demands for services, and both have government-based funding, like Medi-Cal for the US. Both the US and Japan provide some type of health services for the elderly. For example, the US has Medicaid. These are the main important similarities that I found between the US and Japan. Okay, now let's review the differences between the US and Japan. Japanese citizens don't have one dedicated family physician like the US. As mentioned before, my sister-in-law, who is in Japan, mentions, quote, there are not really general doctors that deal with anything. If you have a sore throat, you have to see a throat doctor. If you have stomach issues, you need to see a stomach doctor, etc. Now in Japan, there's easy access to health insurance due to universal coverage. There is also longer hospital stays. And in Japan, there are higher life expectancies. Like, for instance, males live up to 76 years of age, and females live up to 78 years of age. Healthcare facilities are largely owned and operated by private sector businesses. These are the main important differences that I noticed between the two. Okay, let's move on and talk about the quality of healthcare in Japan. Japan's quality of healthcare holds high life expectancies due to Japan establishing an inexpensive approach for all their citizens to obtain access to health coverage. Benefits for all citizens are the same, including dental and mental health. Although there aren't many primary physicians, Japan's healthcare system provides its citizens with the basic necessities covered. As mentioned before, I interviewed Diane Yet, who is my sister-in-law and is currently living in Japan. I asked her, Do you feel that Japan's healthcare system meets the needs for you and the citizens in Japan? Her response was, she thinks insurance is adequate, with the only setbacks being time spent in waiting rooms and having to look for a specialist. And also quotes, most hospitals have the personnel, but they only come 3 times a week. Many doctors will be hesitant to do tests or prescribe medication unless you are likely really dying, but it also depends on the facility. Clinics tend to be stingier in hospitals. She also makes an observation about medication. She quotes, I noticed that many supermarkets will compartmentalize their cash registers. I tried to buy ibuprofen at the food market section when they told me I needed to walk over to the register at the pharmacy to buy it. So medication is treated much more seriously here. Not to mention lots of meds that are legal in the US are outright illegal here, like psychotropic drugs. Also, Vicks Vapor Rub is weirdly restricted too. So I found this interview very interesting. Here in the US, we are freely to purchase any medication, over-the-counter medication, at any time that we desire. When we have the flu, when we have a headache, anything that's going on with us, we can just go to our local drugstore and purchase any medication. But it seems like Japan has a more serious outtake of medication. My interview, like I said, with Diane was very interesting and very informative. It was a very fun experience for me. I hope with this presentation you were able to understand Japan's side of the healthcare system and distinguish the similarities and the differences between our healthcare system and Japan's healthcare system. In my opinion, I feel because Japan has a high life expectancy, that so far that they're doing a good job. Yet, like every other country, there are some setbacks, but it looks like Japan are taking good care of their citizens. So with this being said, I hope this presentation was well informative and I hope you enjoyed it. Thank you.